Welcome to my talk. This is Junpyo Choi from Kyungil University, Korea. I will give a talk on how to provide privacy-preserving data for hybrid blockchains of a remote healthcare environment. So, it will focus on the privacy-preserving usage of medical data stored in a hybrid blockchain. This shows the sequence of my talk. Smart healthcare is to provide remote healthcare monitoring and treatment over an open network. It is quite important for smart healthcare service that the patient's condition should be monitored at all times. Smart healthcare is especially good for patients who have difficulty to visit hospitals, such as patients with infectious disease or these with reduced mobility. Due to the infectious disease, such as COVID-19, the researches are more actively conducted. Like researches of real-time health checkups and patient monitoring using wearable devices. However, the research must be with a measure to ensure security and privacy of medical data. There are two features in privacy: anonymity and unlinkability. This talk will more focus on the anonymity, which makes undistinguishability of personal. Data de-identification technology is required for it. De-identification is classified into data masking, aggregation, data reduction, data suppression, and pseudonymization. There are many related works. However, this talk will consider two closely related works. First is a blockchain-based smart healthcare system for the elderly and chronically ill patients by Cordestini et al. Even if the system could store patient data securely, it does not provide privacy of medical data since patients' personal information is exposed. Even though adults' remote monitoring system could remotely track the status of infectious disease patients in real time. However, this research is weak against a malicious attack. No measures were provided to protect patient privacy in this research. The goal of this paper is to ensure privacy-preserving data provision. To do this, we will design a filtering module by applying the identification, anonymization, and access control. The identification mechanism is used to provide anonymity of data. It uses access control to differentiate data access right to each entity. It could hide privacy-related sensitive data even to the authorized entity in the system. This shows the system configuration for the proposed data provision. There are three main entities in the system: hospital, with service manager, doctor, and patient. Each entity has different roles. Patient has responsibility to generate medical data and would ask medical treatment to doctor. Doctor diagnoses patient based on the collected medical data in the data structure and gives a prescription to treat the patient. Service manager supports all medical service to every entity. The entity could only access the data structure by passing through the proposed data filtering module in between the data structure and the entity. Thereby, the proposed system could provide not only security but also privacy preserving. This is the core part of our proposition for privacy preserving data provision, which is the data filtering mechanism. The identification is a technique that modifies part of or all of data so that it cannot identify any particular individual. Access control could classify data, access right, depending on the entity's role. A hybrid blockchain could store privacy-related data securely. After applying the data filtering module to the data structure, patient could access their data and could see this screen. It shows how they choose their doctor in charge. The patient can view the doctor's appointment date and select a doctor in charge. However, the patient's name should be not open to others. So we apply the identification technique for the identity-related information to make data, so that particle data change could be applied to the given information. Patient should check doctor's diagnosis. The patient can view the diagnostic data generated by the doctor after the treatment. Next is doctor's role and data provision. Doctor should regularly check patient's medical data for diagnosis. Because privacy-related medical data is stored on a private blockchain, only authorized doctors can access the data. Access control should be applied first, and the identification mechanism should be used to keep the privacy of the patient by using the data filtering module. Service manager is one of important part for data filtering module. The service manager checks the flow of data and manages, updates, and many more works on medical data. The data flow is to keep a chronological data order of patients and doctors. Since the service manager does not have access right to the patient's medical data, it is quite important to filter privacy-related data to the service manager. Analysis should focus on the privacy of the system. The data filtering modules is the core part of our proposition. For that, we need to consider the core mechanism, which are the identification, access control, and blockchain. The identification mechanism could ensure privacy by applying a mechanism for the patient unidentifiable. Access right to data can be granted through access control, and only accessible data should be provided in the screen. Blockchain could keep the security of medical data. We can further consider the details of each mechanism. The identification mechanism is applied to provide anonymity of entity. It is applied to hide patient's data, especially. Masking the patient's name could be applied based on it. Access control could be used to filter privacy-related data. Rule-based access control ensure that only the entity which has access right to the specific medical data. Blockchain is used to secure medical data especially. Patients must be able to safely keep their personal data to protect their privacy. The centralized storage method of the blockchain assures that it cannot modify or delete data because network participants always share and verify the chain where the data is stored. By applying a blockchain with these characteristics, patients can keep security and privacy on their data. Smart healthcare could provide various conveniences to patients. However, the related works have lack of security and privacy preserving. So, this paper proposed a privacy-preserving data provision for medical healthcare. For that, we proposed a data filtering module to apply privacy-preserving to blockchain data structure for smart healthcare. Access control and the identification mechanisms were used to provide privacy. The proposed system could be applied to various service applications, which requires not only security but also privacy preserving. Thank you very much for your attendance.